Hello, I'm Donald Abrams, founder and CEO of Clinical Compensation Consultants. Thank you for taking the time to learn about our products. At this point, I would like to introduce you to our baseline clinical assessment, or BCA for short. What if you could save $150,000 on a claim by distinguishing pre-existing conditions from the compensable injury sustained? All of this with a bulletproof medical documentation to support your determination. When I began in workers' compensation, the law allowed for contesting the extent of injury, but lacked the standards of how to contest the injury from an objective, evidence-based medicine perspective. When I first started, the adage was, fill in the blank did not hurt prior to the injury, and now it does. Therefore, everything wrong must be covered by the compensable injury. We all knew this was not medically sound determinations. With this issue in mind, I created a product called Early Compensability Assessment. However, with the advances in medicine, more sophistication with MRI evaluations and the newer generation magnets, and with the advent of evidence-based medicine standards, we have upgraded this product, expanded its capability, and now can offer you what we call a baseline clinical assessment, or BCA for short. Let us look at a real-world example. The injured employee is a firefighter. Amid a 24-hour shift, and after battling a blaze for 6 hours, returns to the fire station and takes a shower to wash off the grime. Coming out of the shower, a slip and fall occurs onto an outstretched right upper extremity. And to mitigate the sequelae of the fall, a twisting injury involving the lower lumbar region occurs. There are immediate complaints of distal right upper extremity pain, as well as low back pain. Your injured employee was evacuated to the local emergency room. During the course of this emergency room evaluation, plain films of the right wrist were obtained. It was noted there was a severely comminuted distal radius fracture. As you can see from the imaging study just shown you, the wrist pathology is acute, a severely comminuted fracture clearly caused by the reported mechanism of injury. This injury is unquestionably compensable, and this injury will require surgery, rehabilitation, and other services. However, in evaluating the lower lumbar region, plain films and a CT scan of the lumbar spine were obtained. However, a look at the imaging lumbar studies notes severe, advanced degenerative disc disease, facet joint arthropathy, and other chronic conditions. This pathology developed over years and not from a single twisting motion. None of these findings on the lumbar studies are related to the compensable injury reported. After reviewing the right wrist x-ray, you can see that the fractures will require surgery and rehabilitation. Those treatments and interventions are clearly compensable and related to the injury and should be covered. However, by excluding the unrelated lumbar pathology as identified on CT scan, not only have you saved significant cost, you've expedited the return to work, avoided tens of thousands of unnecessary medical costs, and you're a star. Here is why the BCA delivers value for a fraction of the potential claim costs. This study can be returned within 4 business days. Our evaluation will evaluate all the documents to an evidence-based medicine standard, exactly which injuries are compensable and which represent a pre-existing unrelated comorbidity. Our professional staff of medical experts apply a specific standard. We exclude conditions only when there is specific, objective clinical data confirming that the work injury did not materially worsen any of these pre-existing conditions. This gives you bulletproof medical documentation to limit the extent of the claim to the actual compensable injury sustained. In this case, the identified wrist fracture, clearly related. The lumbar pathology, not so much. The standard for excluding unrelated comorbidities, noted as pre-existing pathology or other findings that are in no way related to the compensable injury sustained, is that there is no specific objective clinical data that the injury accelerated, aggravated, enhanced, exacerbated, or otherwise negatively impact or worsened the identified objectified pathology as a function of this event. Therefore, you as the claim file handler have all of the appropriate medical information necessary to exclude this lumbar pathology from the accepted compensable injury. By applying the standards of evidence-based medicine, you have mitigated the extensive costs in terms of pending lumbar surgery, hospitalization, rehabilitation, medications, and any other potential complications. Just so I'm clear, the wrist fracture will require surgery and rehabilitation. However, this treatment will allow for a return to work much sooner than had the lumbar pathology been incorporated into the accepted compensable injury. Therefore, I would ask that you please consider the use of a baseline clinical assessment with all of your significant lost time claims so you can establish the extent of injury and treat that injured worker as expeditiously as possible. This will limit your exposure, this will limit your costs, reduce your time loss, and get that file off your desk. So, on behalf of the professional staff of clinical compensation consultants, our entire team, and myself, thank you for taking the time to review this video. Are you ready to see how a BCA can protect you in your next claim? Contact me via this webpage, and I personally guarantee a response within 24 hours. Again, thank you for your time, and we do look forward to working with you.